They also didn't read the old memos that said that Mayor Lindsay, who gave workers this healthcare program, and even Mayor LaGuardia in the 40s and 40s that gave us the HIP program, was to be able to have healthy workers. He wanted workers to have health care so that they would come to work. And remember, it's the 40s, so it was mostly a male population working, and that their spouses and their children who were home can go to the doctor if they needed to, and the worker could still come to work.
Okay, readers and viewers of the Staten Islander news organization, we're here this morning once again with Marianne Pizzitola. For many of you, she's a well-known name. For some of you who may be, I guess, new to everything or just woke up after a very long sleep, maybe Marianne, this time you could do a self-introduction.
Sure. So I'm Marianne Pizzitola. I am president of the New York City Organization of Public Service Retirees. This is an organization that I started in 2021 for the sole purpose of protecting the health care that was promised to New York City municipal workers going over the decades. And we have had to sue the city multiple times, and we've been successful almost all the time, actually all the time, 11 times, 3 unanimous appeals decisions, and we're just waiting for one of our last decisions to come down from the highest court in the state, where this was our second visit there. And so that's what we're doing. And we're working on legislation as well to protect retiree health benefits from being diminished in their retirement. So we're pretty busy these days.
Yeah, and that's a noble cause, which affects probably a lot of people out there. So, Marianne, what are some of the unions and some of the what those unions represent in terms of workers that are involved in all this?
So there's this umbrella group of unions in the city of New York. There's like 152 unions in the city. Only about 102 belong to this committee called the Municipal Labor Committee. And it's a voluntary organization, although many don't know it. And it kind of controls, kind of like the mafia, which is another thing we've been working on. And that organization believes that they represent retired workers, which they don't because we're not in their unions. And they feel that they had the right to negotiate away our healthcare to finance their contracts 4 years ago under the de Blasio administration. I think they just need more of an education, and they have to remember what we fought for, because they have what we fought for. That's why they have the benefits that they do, and shouldn't be privatizing federal public health benefit of Medicare for anybody.
Okay, so Marianne, just for anyone who again missed the other interviews, what union were you in and what did you do for a living?
So I was retired from District Council 37, Local 2507, EMTs and paramedics, and I worked in FDNY EMS during my career. So when I left and retired, I retired from Local 2507, and the parent local or district union was District Council 37.
Okay, and again, um, what types of workers are under that umbrella? So it's EMS.
In 2507?
Oh, I mean all the unions. Well, I mean your
Oh,
union. First, I guess your union, and then more broadly, the unions under that umbrella thing.
so in Local 2507 today, that includes EMTs, paramedics, and fire inspectors. So they broadened a little bit further than when I was there, which was just EMTs and paramedics. In the Municipal Labor Committee, it's 102 unions within the city, and those unions in that organization would be UFT, all the 62 locals of District Council 37, the police locals, the fire locals, all the other ones like CWA, the Teamsters, sanitation, corrections. So anyone who voluntarily wanted to join that organization. In my organization, New York City Organization of Public Service Retirees, we take everybody. And so we fight for everyone who is currently a municipal retiree that's Medicare eligible.
Okay, so basically, it seems like everybody that keeps society going in a big way. Okay.
Runs this city, yes, day and night.
Okay, so like I said, viewers and readers, this is interview number 3. Hopefully this is the trilogy and like this is the end and it's like the last big interview and after this it's all resolved. Um, you've already explained what the issue is. It's a little complicated. It's a little strange, like getting into it, how there's
Is
this group involved and like they somehow dictate what the different unions want, even though they're not elected and nobody votes for their choice. Confusing.
yeah.
So what's new since the last time? So the court cases, there have been 2 that have been won, I believe, and there's one that's still active. So maybe
So
Mary,
a little rundown of each of them.
yeah, sure.
So we did file 3 court cases. The first one was filed in 2021, and that was what the city has to pay for our health care. The interpretation was pretty muddied by the city in what that standard was. And we won that case all the way up to the New York State Court of Appeals this past December. The second case that we had filed was in 23, and that was like January, I believe. And that was the copay case. What that one was when the mayor was given an injunction on the first case, he tried to see what he could do to make it as painful as possible for us to stay on traditional Medicare with our city paid supplement by putting a penalty on every procedure, every test, every office visit on our traditional Medicare to make it as painful as possible so we would be moved over to the Medicare Advantage plan that he was trying to force us into. We got an injunction, he had to stop that. They ultimately ended up reversing that decision, that injunction, because it was a contract issue where the contract was being violated. It didn't permit them to charge us copays. So they illegally charged us $53 million in copays, which they now have to figure out how to give back to us. But since they revised the contract, they started charging us those copays this January, which again, on many of us low income people, that's forming like a car payment to many of us in just because you're going to the doctor or having tests done. The third case we filed was in May of 2024. And that case we won in Supreme Court, the appeals court with a unanimous decision. And then the mayor appealed both losses and brought it up to the New York State Court of Appeals, where just this past May, we had oral arguments there. In that case, we've dubbed the nuclear option. What that means is that the mayor then, after losing all of these times, sought to eliminate all of our choices of healthcare plans to force us only into a Medicare Advantage plan with no options or choices outside of that. And now we're hoping that this court affirms the 2 lower decisions.
Okay, so Marianne, what is this big push toward getting the workers to this healthcare plan? Maybe you could explain some of the apparent or seeming motivations of elected officials and others. Like, why do they want? It seems like this is going to harm people who worked hard, risked their lives in many cases, for the people of the city, for the city. So what's happening? Why do they want to do this?
So this population is elderly, over 65, disabled, 9/11 responders and survivors, also line of duty widows, which there are many in Staten Island, and our disabled children. They're also retirees that retired decades ago who today are 90, 100 years old. So they don't have the ability to travel further to see a doctor or pay a higher cost. Why did they do this? This was forced upon us because it was a deal made between the Office of Labor Relations and the Municipal Labor Committee, and it started with the United Federation of Teachers, where they didn't have a contract in 2014 and they wanted a contract, and de Blasio said, well, then you're going to have to pay for it. And what they did was there is this special fund that has no oversight and is controlled strictly by the mayor and this umbrella group, and they were misusing it to use it to pay for raises for that union and for collective bargaining. That fund was supposed to be paying for premium for their health care, not mine. Anyone who's not on Medicare, it pays for the premium difference of their healthcare between what the city pays for and any cost that's above it. That fund would have taken care of what the city doesn't pay for. So it was supposed to be a protection to keep your healthcare premium free. That is why they did it. When that fund started running out of money, they then came up with this funding mechanism, which was to sell off our healthcare, put us into this Medicare Advantage plan, which the vendor was offering to the city for free, and said, look, if you put those retirees into Medicare Advantage, we'll give you the money we would have spent on them. We'll give it to you and put it in that fund. And I have a video of Michael Mulgrew from the United Federation of Teachers saying that in 2022. The city said if we give them back that 20% plan, which was referring to our supplements, the 20% is that portion that Medicare doesn't cover. This was that gap filler. We'll give you that money. And they did. They were told it was the same, it was custom, it was better than anything that we'd ever seen. It had a free gym pass and frozen dinners when you get out of the hospital, and taxi rides and a Fitbit, and they'll just love it. Clearly, they didn't do their homework and they never read the contract, sadly, and we got forced into it, and our organization had to stop that. They still, to this day, many of them don't understand. They just think we messed up their plan of funding this fund for them and not recognizing what they did. Some of them do recognize it, and those locals have actually been supporting us for a very long time. So we do have some union support there, that I appreciate.
Okay, so it sounds like it was a mismanagement of funds by these groups and then just basically not really doing their work very carefully and not really being concerned enough about, the outcomes and how they'll affect real people and real families.
That's a really good way to say that. And I'll also tell you that Mayor's Office of Labor Relations actually encouraged them to do it, that it was okay to do when it really wasn't. And that it's the same or better because it's custom, because you're creating it. You should do this. And that goes back to a very long time ago, back in the 80s, when the gentleman that actually negotiated these recent agreements, Bob Lynn, who was part of the city back in the 80s under the Koch administration, had wanted to dismantle the administrative code that provides us with all of our health care and pass more costs on to employees. But he had to find a way to do it. And the only way that they could come up with was encouraging the unions to force us into this Medicare Advantage plan and finding a way to drain that stabilization fund. And that was the fund that they eventually bankrupted.
So there was some kind of nefariousness then and some kind of intent to push things a certain way for a certain political, economic reason. That's really interesting. Something
Yes.
I've read since the last interview with you, I don't remember where it was almost like saying that the people who are fighting, such as yourself, aren't really realizing how good you'll have it under the new Medicare Advantage, or that like this is like a moot point and you guys are just doing this and there's no purpose. Can you explain to our audience why that's totally a false viewpoint, please?
Yeah.
Thanks.
So that's a great question. Medicare Advantage, no matter how custom you make it, and the only thing that's custom about a Medicare Advantage plan is the perks that they offer you. And we have Aetna on tape saying that. What's custom about this plan is the two networks that they added, which was Memorial Sloan Kettering and Hospital for Special Surgery, as well as the other perks like the gym pass, the $200 gift card, the frozen dinners,
Oh,
those
those
kinds
things
of
were
things.
real? I thought you were actually giving like
No,
joke examples.
not kidding you. Yeah, you buy car insurance to make sure that your car is insured, and when you need it, it's there to fix or
Right.
replace your car,
Yes.
not to get an extra pair of Reebok sneakers or Nike sneakers in case your tire goes flat. You pay for insurance to insure you.
Yes, that
In
makes
this
sense.
Yes. And in this deal, they were trying to sell an insurance plan with perks because it is at the direct expense of access to doctors and hospitals that you're currently seeing or you might need as you get older or become, more disabled. Um, Remind me of your question one more time. The original question.
Original question.
It was about the perks and the benefits and stuff and what.
Why that's false. Okay. So in that, those perks, like the $200 gift card, It is a direct expense. It's at the direct expense of your access. So in traditional Medicare, there are no networks of doctors. 99% of doctors in America accept Medicare. The 1% that don't are typically pediatricians and psychiatrists. Medicare has rare prior authorization. So if your doctor says, Marianne, I want you to go have this test, you go. If you're on Medicare Advantage, you have to make sure the doctor you're seeing is in their network. And two, you have to ask that insurance company for permission for that test or procedure. And that could take you days to weeks, typically weeks, before that gets approved. That's a delay in care. Now, the cost factor, even though like the city would say being told that this plan was free to them, it was contracted for 5 years that it would be that way, and it was based upon the volume of people in it. So the more people that said, well, if there's my doctors don't take this plan, I have to opt out, they were still, quote, saving money because they would end up waiving all of their city, they were being forced to waive all of their city benefits just to purchase a supplement on the outside to stay in traditional Medicare. That's the dangerous part that people weren't recognizing. While the cost was free to the city, it was costing the retiree more, and it was also costing these Medicare Advantage plans cost you out of your federal tax dollars even more. And why is that? When you have Medicare, the only thing the government is charged is when you have a procedure or a test or you go to the doctor. It's called fee for service. You go to the doctor, they bill Medicare. That you have a test, they bill Medicare. If you don't go to the doctor, there are no charges. With Medicare Advantage, Medicare is basically saying, hey, Aetna, I don't want to do, or New York City doesn't want me to handle Marianne's Medicare anymore. We're going to give it to you to administer, and we're going to pay you $1,500 a month to do it. Whether Marianne goes to the doctor or not, $1,500 a month. Then they try to do these things where they'll offer you a gift card, like $50, to come to your house and say, hey, Marianne, I'm Aetna. I really care about you. I want to come and do a healthy home visit. And then when they ask you a million questions, they recognize I am a 9/11 responder. I have these other health issues. They leave out the part that the World Trade Center program is covering that. Then they leave my house and they go, whoosh, Marianne, what a train wreck. We're going to have to, Medicare, you're going to have to give us more money because Marianne's a higher risk to us than we originally thought. So they start to list all of these things that they're not treating me for, and that's called upcoding. And then Medicare goes, oh, we didn't know Marianne was in such a bad way. We'll give you $2,000 a month now since she's such a high risk. Now, where does that money come out of? Your federal tax dollars. So while the city isn't paying for your $200 a month supplement, you're definitely paying out the nose out of your federal tax dollars for all of these people in Medicare Advantage.
I think that's an important point that people should know. This is really not just disrespectful, but for the people who, helped after 9/11 and even, lesser tragedies. There's tragedies every day in the city. It's like basically telling you guys, like smiling in your face, but secretly doing something not good. Because from what you say, there's nothing good in this. So the private aspect of it, who's the private aspect of it? That's one thing I think I've been unclear on the whole time. Like, where's the private? And so that means some private company involved in this is now getting part of that $1,000 you were talking about.
Yeah, so in our case, it was Aetna. Aetna was the main company that they were trying to force us into the second time. The first time, it was an alliance between Emblem and Anthem. And because the court case dragged on, Anthem walked away, basically leaving Emblem Health by themselves, and they could not administer a full Medicare Advantage plan nationwide. So they went to the second bidder, which was Aetna. Now, companies that do this, they're Aetna, Anthem, your Blue Crosses, your Humanas, Cigna, United Healthcare. These are all people that run Medicare Advantage plan. Medicare Advantage is not a federal program. It is an alternative to the federal program, and it was designed to be a choice with the hopes that it would save money, and it's done anything but. And with us, it wasn't a choice. It was a mandate because of a federal statute that was changed with the outgoing Clinton administration and implemented under the Bush administration that allows any union or employer to auto enroll their retirees into Medicare Advantage for seamless transition into an MA plan. Meanwhile, you're not on the job anymore. You no longer have an employer. You no longer are in your union if you were an employee in a union or had one. And yet they're making this wild decision to force you into a plan to save management money that your doctor or hospital may not accept. And you have no say in that process.
That's crazy. That's unbelievable. And I'm happy that you're just explaining it all clearly like this, because I think there's a lot of interest out there muddying the waters for people and trying to make it seem like, oh, it's not quite this, it's
Yes.
not quite that. So Medicare Advantage has the word Medicare in it.
Yes.
Is it somehow connected to Medicare? Is it semi-connected? Is it a totally different thing?
There's the rule, the way that the insurance companies like to frame this is we have to cover everything that Medicare does. Well, you do, but how you do it is the problem, because the government does recognize that the private insurance company can put in their own rules and also provides them with waivers to the traditional standard federal rules that they're allowed to mitigate what they determine to be medically necessary. So where my doctor says, Marianne, go do this, and I would go do it on traditional Medicare. If I was on a Medicare Advantage plan, it would have to go through the rule process and the medical necessity guidelines of that insurance company. And if they delay or deny my care, I have 5 levels of appeals that my doctor has to go through, or I have to go through, in order to get that care approved. You don't have that in traditional Medicare. And the reason for that is they are a for-profit company. The only way an insurance company can save money or make money for their shareholders is denying you care or charging you for that care.
That's
There's
interesting.
no
So
other way.
this is a matter of companies profiting, remaining profitable,
Yes.
becoming more profitable. So it's more like Medicare Advantage TM. It's not really the same thing then. It just kind of has this. It's like if somebody opened a company like uh like EMS sweaters, like you sell sweaters and somehow try to link it to EMS. Is that the case? Or
Yeah, so there's actually a bill in the federal government, I believe was by Senator Warren, Elizabeth Warren, and Mark Pocan and Rokahana to take out the name of Medicare out of Medicare Advantage, because it's not, as in the words of Wendell Potter, the national whistleblower, it is not Medicare and it is not an advantage. These are for-profit companies, and this is an alternative to Medicare. But Medicare does subsidize them to it was something that was allowed through this law that allows Medicare to waive some of their rules for employer union based plans to push people in these Medicare Advantage plans. And I believe the push was to privatize Medicare from the get-go. I think that was the total basis. Otherwise, why would the federal government, under this Office of Innovation, whenever I hear those words like innovative techniques, it reminds me of Claire Levitt from our Office of Labor Relations. I think she's like the Deputy Commissioner of Healthcare Cost Containment. She called it like behavioral economics when she testified before the city council. And she was like, she had this like evil grin laugh when she said, yes, we deployed behavioral economics in order to get people to change their behavior and not go to the emergency room. We charge them $150 instead of $50. It's great. You're like penalizing the sick and disabled from going to the ER, and
that's
that's a
crazy.
savings to you.
That's not really
That's evil.
that's unbelievable. Yeah, that doesn't sound like there's another word to describe it.
Yeah.
This whole thing. So how many years has this been going on now for? How long have you been fighting this fight for?
They started doing this to us. They took the first vote on it in March of 2021 in the middle of the pandemic. I started and incorporated this organization in August of 2021, and our first lawsuit was filed in September of 2021.
Okay, now again, talking about the bills and stuff, there was also an assembly bill that was killed and a city council bill that was killed. Maybe you could talk about
Oh,
that.
Yeah, so let's correct some of that. So the city council bill is Intro 1096, and it's still viable. We still are pushing city council members to get on it. Intro 1096 protects a retiree's health benefit from being diminished, which is what they were trying to do to us, like forcing us into an MA plan. And then it also was a stopgap from those backdoor costs they were putting on us, those copays, to not be able to do that. And that's why many of the larger locals like DC 37, the United Federation of Teachers, CSEA, PEF, and the New York State AFL-CIO got involved because Henry Garrido from District Council 37 and Michael Mulgrew from the United Federation of Teachers started spreading rumors that our bill was illegal and violated collective bargaining and violated the Taylor Law. And we were like, how is that possible? The Taylor Law doesn't impact someone like me. I'm not in the union. I'm already retired and have been retired. You made these deals a long time ago when I was already retired. I'm not subject to any of the rules or the laws or the collective bargaining that you do because I can't vote on them. So that is the city council bill. It's still around, and we have like 16 sponsors on it, and I'd really like to get more on that bill to try to pass it this year, because whether we win or lose this case, we still need this bill, or this is going to keep on happening. And I'd like to try to protect retirees and electeds from having to go through this again. The state bill. That bill was necessary because we also noticed that this was happening to other municipal retirees around the state, Nassau County and in counties in upstate New York. And they kept coming to us and asking us for help, as well as retirees around the country. So we'd been pretty busy. While fighting our own fight, we were helping Delaware retirees, Ohio, Illinois, California, that this has been a practice of these big insurance companies. So in the state, as a New York, my city bill, Intro 1096, will only protect a New York City retiree. But then when they did this to New York City Transit, they're quasi-state workers, Nassau County, state workers, upstate, state workers. We had to do a bill for state workers. So that's when we said, you know what? Let's just take a copy of what we did in the city. Let's try to fight this on the state as well and protect every New York State municipal worker. And so we did that bill. It was Assembly 7866, I'm sorry, Assembly 4639, which is still around today. It's held by Stacey Feferamato, Assemblywoman. And then there was another bill, 3607, that was held by Senator Peter Harcum. That's the bill that the AFL-CIO, UFT, and DC 37 killed by pressuring the state senator to get off of it by saying that it interfered with their collective bargaining. And they were complaining to the highest levels of the Senate and the state legislature that this bill interfered with their bargaining, even though it doesn't. And because the legislators were concerned about losing the support of some of the largest unions in the state, including the council's office, they changed the language of the bill. They were going to implement language that was called the moratorium language that says, and this was the language that the UFT and AFL-CIO wanted. It said they couldn't diminish a benefit for a retiree unless they equally diminished it for an employee. And I said, well, that would have been great in 1967 to 1994 when the teachers actually had that language, which is they made theirs memorialized permanently. But those labor leaders then would never have diminished benefits for retirees because they never would have wanted to diminish them for employees. Since 2014, they've been doing that. They've been diminishing benefits for employees and retirees. So to me, if you're asking my permission to support that language, I won't, because then you're saying it's okay to screw a retiree as long as I equally screw an employee. And I don't think either one should be screwed. We're labor and we should be fighting to protect the benefits that we earned and paid for. So I wouldn't do that. They then brought the language back under this new bill, and I don't remember the number, but they basically brought back my original language because we drafted that bill, and they just took out the date. And I said, well, the bill is useless in this form because the date would protect New York City retirees from these backdoor costs. That's the problem. And so now that basically stands still, and I need to find a state senator that's a Democrat willing to support this issue and take up this bill in its original form.
It seems kind of immoral what they're doing. I guess elected officials could claim ignorance on the matter. Otherwise, if they're aware of how this is harming people, there's really not many other ways to describe it. So, Marianne, are you guys, in terms of visibility, is there a visibility campaign, to get the people's faces and voices before, the city's greater population, so the people know what's happening? Because the major media, a lot of times it seems like there's just sound bites, and sound bites don't really do much. A sound bite can be flipped this way or that to make it seem like it's the truth or a falsehood. So,
They're ignoring this and they're being pressured by the larger unions not to report on it, which is what's stifling those messages. And that's been our struggle. We've had, even when we won that case in December, very few of the outlets reported on that. And that was a monumental win to get that. It was a unanimous decision from the appeals court. So we're recognizing that the power that is perceived that a larger union has, it's at the expense of the life and health of the elderly and disabled 9/11 responders, line of duty widows. They don't seem to care. And what that's for. Like, look, District Council 37 literally threatened the elected officials that they would not just lose their endorsement, they would unendorse them if they had endorsed them or given them campaign support if they supported us. That is the ugliest thing I have ever seen in the union movement, that they were willing to threaten an elected official or a candidate for supporting a Medicare eligible retired unionist from protecting their federal public health benefit of Medicare, and urging that they support their position in forcing these retirees into the default plan of Project 2025. And they did. Some of them did.
no elected official or candidate is going to come out and say that they're against 9/11 responders. So, you said in the past they said something about collective bargaining, made a fib. They essentially lied. Is that how they're dealing with this? Because it seems like most people would turn against them if they realize that they're hurting the firefighters, the teachers, the police, EMS, people who dealt with 9/11 specifically. So how do they get people to get on board with this?
Threatening them. DC 37 did have their minutes in one of their last delegate meetings, was that they would unendorse any candidate that supports us, and if they won't endorse them. For example, the mayoral race, they ranked Zoran Mandami, Zellner Myrie, and Adrian Adams, the only three Democratic candidates that will not support us or even speak to us. Now you have Zoran Mandami, who you have all of these young people fawning over, being a socialist and wanting free everything, but he hasn't said retirees should be able to keep their health care. He's not on our state bill, and he can because he's a sitting assemblyman, and he's not supporting us. We met with him. He never returned the pledge to us, and he's not supporting retirees. He could say whatever he wants. Any candidate can say what they want. Look, Eric Adams did that, right? Eric said, this is a bait and switch. De Blasio, if I was mayor, this wouldn't happen. And then what happened? He became the mayor and he did it anyway. I'm not taking a verbal anything from any elected or candidate. If you want to support a retiree and protect their federal public health benefits, as I would have assumed when I started this fight, the Democrats would, it has to be in writing this time, and you have to meet with me and say it to my retirees.
Yeah, this seems like it's a lot of lip service saying that they support everyone, and then in reality, this is a really complex situation where they do self-serving activities. So that's sad.
Yes.
So Marianne, how do you go forward from here? What do you think might be the best areas of focus? Because you guys have valid points, you have valid legal points, points that the largest segment of society would go with. Who's going to oppose this? That's really, like, I understand, the higher ups, they have their motivations, but as far as the actual people of the city, the people of our country, so what would be a good way of going forward?
Well, it's still speaking to the legislators. You're in Staten Island, right? So
Yeah.
you had Joe Borelli, who didn't support us. We helped elect Frank Morano. Frank supports us, and he actually called and said, my very first official duty was supporting you. I signed on to 1096. We were excited. Then you have Camila Hanks, who's a Democrat in Staten Island. She could be on this bill. For 4 years. She's ignored us. So we got behind Abu Ducate, who's running against her. You have David Carr. David Carr is not supporting us. I don't understand why we're having this fight. You have Ina Vernikov from Staten Island, who's supporting us 110%, and she's been behind us since this fight started. So the only way to keep doing this, keep trying to win over more people, is keep educating them as to what Medicare it is, that it was one of the greatest civil rights achievements ever, that it stopped colored waiting rooms and white waiting rooms, and it allowed people equal access to healthcare no matter what their skin color or their income was. And to be forcing people into a managed care plan that does that would discriminate against you based on income, because you won't have access to those doctors if you can't afford to pay. And tiering a hospital access or medical access based on income is cruel. That was the whole purpose of what Medicare was about, was to make equal access to everyone and give everybody equal access to the best hospitals and the best doctors on your choice.
That's very interesting.
So, yeah, I'm trying to get a hold of a documentary that was released just before, I think it was 1920 and it was one of the experts that was on there was from CUNY system, and it was called Heal, The Power to Heal. And it was about Medicare, and it was narrated by Danny Glover. So I'm trying to get that documentary to air to everyone, to educate them, to understand why they should be on this, and that the unions that are supporting this move are on the wrong side of history.
Okay, so how can our readers help? And you can answer in two parts. Like, I understand people can contribute, to the fund, but how can our readers help if they can't afford to contribute also?
So if they can afford to contribute, and we've never asked for more than $25 donations or monthly donations of $10, $20, $25, $25 a month, whatever they can afford. If they can't afford that, then they do have another power, is help push their elected official, whatever city council person that they have, to get on Intro 1096. And that's a phone call to their city council member. And if their council member is not supporting them and their opponent is, and they can check by going to our political website, which is retiredlaborstrong.nyc. It's separate from our organization's website of nycretirees.org. And then pressure those council members to get on the city bill, and also their assembly person to get on the assembly bill. The Senate bill, I'm going to need a state Senate sponsor. So if you know someone that's willing to help me on that, then they should say, hey, Marianne, I spoke to my senator and they want to sponsor this bill for you. Let's go, because we want to bring this back in January.
And Marianne, are any changes at the federal level relevant? There's a new administration, there's RFK, they have a lot of different ideas. Does any of it intersect with this issue that you guys are experiencing, or? Okay, so again, I was talking about the changes at the federal level, and you were responding when we rudely interrupted, so I'm so sorry.
So we're not feeling anything yet from the federal level. We're watching what they're doing, because we know that the more that comes out about how bad Medicare Advantage plans are, we're hoping that they recognize, if they were looking for fraud, waste, and abuse, I mean, you really can't look any further than Medicare Advantage plans, because you've had upcoding, downcoding, denial, wrongful delays and denials of care. You've had congressional hearings on it. You've had Aetna testify in our own case before Judge Frank that retirees, if they were pushed into this plan, that they would be instances where they would lose their doctors, lose their hospitals, and then they would be denied care that their doctors want them to have. So that, to me, isn't setting the precedence of what we should be protecting, people and access to healthcare. So if that starts to happen, I can't even tell you what will happen out of Washington. I really can't. We're just watching, seeing what they're going to do. The more reports come out, we're hoping that someone down there is watching. I'd have no problem going there to speak to them about this issue, that it should remain a choice, and the programs need to be fixed. They should not be allowed to have these waivers. They should not be allowed to deny people what they would have had if they were in traditional Medicare. And I think at that point, though, it would pretty much do away with Medicare Advantage plans, because this was a profit-making scheme for those for-profit companies.
Yeah, the word scheme seems fitting. And
Yeah.
I guess, we don't know what might happen at the federal level, but they talk
No.
about workers and, bringing jobs here. But, to have jobs here, the workers have to be healthy. And this is like, the unofficial capital city of the world, New York City. In visibility terms, this is, the major city. And I think the rest of the country will follow. So if our workers here aren't being treated well, and the whole idea is to bring jobs here, it seems like that's a big element of it, is jobs need to have workers who know that they're going to be taken care of. Otherwise,
Yeah.
there's no
Let me
security.
add to that, because you just hit something that's really important. Part of our case was, and I'm going to see if I can pull up this while I'm talking to you. Part of our case, we had an affidavit by Lillian Berrios Paoli, who worked under several mayors during her tenure for the city of New York, and that she said this was a recruitment and retainment tool, New York City's health program, that they would pay for your health care while you were employed, and that you would have Medicare and a city paid supplement when you retired, like a form of deferred compensation. So the city's attorney actually argued that that's not true. It's not true. Why would we call it a retain attract in order to attract and retain workers? And where meanwhile you have a courtroom filled with 100 retirees going, yes, you did. And that affidavit has been in there now for, 2 years. And not even the city put in an affidavit to the opposite. Like, if you thought this was wrong, don't you think you should have had someone put in an affidavit that Ms. Berrios Paoli, former deputy mayor, was wrong in why the city did this? They also didn't read the old memos that said that Mayor Lindsay, who gave workers this healthcare program, and even Mayor LaGuardia in the 40s that gave us the HIP program, was to be able to have healthy workers. He wanted workers to have health care so that they would come to work. And remember, it's the 40s, so it was mostly a male population working, and that their spouses and their children who were home can go to the doctor if they needed to, and the worker could still come to work. He wanted it low cost. And at the time, the city still was cost sharing premium at the time. Workers still paid a little bit. And it wasn't until 1967, where the workers were paying like 25% of the premium, did he say, we're going to pay the full cost of healthcare, Mayor Lindsay. And we're going to give a choice of plans that work for you. Well, in a press release that when they came out with the active worker plan, which I'm sure we'll probably need to do another interview later on this when this starts to come out, the active worker plan and non-Medicare retiree plan is finally going to the Municipal Labor Committee after a final vendor was chosen. And that was a consortium between Emblem Health and United Healthcare. And in that, Mr. Garrido put in a statement in this press release that was distributed by the mayor's office. And it says that they look forward to this next step, negotiating this active worker healthcare plan, and that it'll be going to the MLC for ratification. He says, we're navigating a challenging road to get to this point, but the result is a tentative selection of a new health plan provider that will allow us to increase the quality of benefits for our members, and rein in predatory costs. This can all be done while preserving premium-free healthcare, which is vital recruitment and retention of our city workforce. And I was like, now you're saying it's healthcare is a tool for attracting and retaining employees. It would be stark contrast to tell you that since before COVID, or just around COVID, they lost about 30,000 workers now who are watching this debacle, as well as all the other healthcare related things like the mandatory vax that they were putting through and whatever, wherever you stand on that, to show what's happening to workers, taking benefits away from them or reducing down their healthcare. Why would someone want to work for the city when you could spend your whole life working here with the promise you would have something, and when you're gone, they claw it back from you? This is why we're still short about 20-something thousand workers in the city of New York. It is an attraction and retention tool, and they've been abusing that. And the people that served and built this city, and after 9/11, rebuilt it.
Thank you so much. That's all the questions I have for today, Marianne.
Great.
Definitely we appreciate having you on here again. And just to let you know, like, you're like a local hero to people on Staten Island. Like, everyone knows your name. And I just feel like everyone's depending on you, and no one themselves knows what to do on their own. I don't think anyone has any idea of what they could do personally. I don't think that they think there is a possibility that they could do anything personally. So you're saying
Really?
that
Okay.
they can contribute. How about
That
contributing
pressure.
their time? Is there a way of contributing their time to your organization, or?
Yeah, so if they sign up for our newsletter, we put out a newsletter like every 7 to 10 days, and it tells you what's happening, where we're either phone banking for a candidate that we'd like to get into office because they would support us. If we hold rallies, they're welcome to come out to those as well. We just did a town hall with Councilman Chris Marte last week, so that's another thing that they could. All of those events will be in our newsletter. So sign up for the newsletter at nycretirees.org and join us that way. I don't necessarily have to, you don't have to provide financial support, but the best way you can get involved is the advocacy to get people in office that would protect you. We're working right now with a new advisor in what we can do to get more people on these bills. And once I do that, I'll make a video on it, and I'll make sure I send you the link to share with people that follow you.
Thank you so much, Marianne. It was great speaking with you today. Is there
You
anything
too.
else you'd like to say in closing?
No, just have faith and don't listen to the rhetoric. Just keep focused on what we're suggesting is help us get these people that support us elected. Go to our political website to see the ones that are supporting us, retiredlaborstrong.nyc, and anything that we can do, just email us directly to the organization, retirees@nycretirees.org, and we'd be glad to help you. And as soon as we roll out this next stage for the political campaign to try to get these bills passed, you can help us surely with that, with our rallies and press conferences and trying to get those bills passed. The state bill may have to wait till January, but we're going to still push this city council bill, and you're more than welcome to help join us with there. And thank you so much for staying on top of this issue.
Okay, so this concludes our third interview, Staten Islander News Organization, with Marianne Pizzitola today. And I hope that any readers or viewers out there feel a little less discouraged, because I know it can feel discouraging. This is like everything looks like it's going well, not going well, going well, not going well. So, okay, thanks again, Marianne.
You're welcome. Thank you.
Okay, stay well, and hope to see you soon. I hope you guys have a real, decisive victory in the near future.
Amen.
Thank you.
Okay,
See you
thank so
soon.
much.
See you soon.
Bye-bye.
You're welcome.